I could just leave you with like a few comments.
Yeah.
They just.
But I'll be around.
Like when there was age rallies,
Thank you.
last week, there was a lot. There was the women's rally and the students. I was exhausted. I'm like, I was so done with this. I mean, I'm glad that they're back because that means stories and content for me, but
And
when it's too much, I'm like,
like, I love it, I love it, it's great. You're exhausted.
yeah, yeah.
And then there's like.
And then there's like who can outstand all of us.
I know.
Come on, Lee.
He comes on there and we're talking about running everywhere.
Just,
Which you were running?
Yeah.
Every day.
Every day.
And then it was juxtaposed with you going. Yeah, I don't know.
Lee's always there, but he doesn't run.
These new knees, you know.
They're new.
Yeah, no, they say.
You should be.
They tell me I'll wear them out. When am I gonna wear them out? How many?
I think it's gonna be more like,
Oh,
Who else is new?
so we heard from Samuel Aquino, Danes, and Martinez.
Yeah.
Sometimes I think Diana, sometimes
no,
we're
you guys
before.
need. I have lost one, like, I put one on the
I
test
would love
2
to be
days
this
ago.
week, but next week for sure, I'd like to get a shot, but.
Cause I literally had to give that woman I shot that footage for yesterday, I had to give her that car. So she gave me money to buy a new one, which was fine.
But anyway.
But like, now we're down to one car.
If you see that coming together, even if it's.
I think it's really brutal. I've done.
Yeah.
Director of the House Department.
I'm pretty sure she does. There's just another car floating around here somewhere. This is our sweet. It's the only thing I don't like.
Yeah, the two parts were.
Well, I didn't, and that's like the last SD cards.
I steal everybody's SD card.
You wanna give me one?
That's
So that's where my cards are.
You steal.
Check
Well, now
17.
I'm down to
Like
like
my
4.
ten steals out of speaker.
It's like whenever somebody comes into that office, they film something, I just.
You know these micro live, you just
seat over here, this thing, moved over.
Do you mind if I mention 350?
You want an email version too or no?
What were we leaving at? And I know Heather got called to a meeting.
So, who's gonna be your girlfriend? How are you? One, two, three, four. Yeah?
Anybody else comes?
One, two, three, four. Two. Make sure you make us look thinner, guys. Okay? You tell us whenever you're ready.
Just a second.
Good morning. I'm Senator Marty Sandoval from the 11th Legislative District. I'm joined by some of my colleagues in the Senate, Senator Omar Aquino, Senator Iris Martinez, and Senator Dave Kaler, all of us who have worked ardently over our careers to ensure that the poor in Illinois are taken care of adequately when it comes to Medicaid and health care. Recently, the administration, the Rauner administration, filed a purchase for care, RFP, if you may. They've decided just overnight to take a whole different approach to managing health care for poor people, Medicaid patients in Illinois. And they've decided to put out a proposal and particularly just invite certain number of MCOs, for-profit MCOs, to participate in this procurement, if I may. Let me talk to you about the impact of that and how that's going to impact the minority communities in my district and in the districts of many of the folks that are up here today. I represent a district that has one of the highest number of Medicaid patients in Illinois. And these patients have been taken care of by Family Health Network. It's a non-for-profit, it's a healthcare plan of non-for-profit hospitals that 20 years ago decided to take care of the poor because no one else would take care of the poor. These are Medicaid patients that are being turned down at the for-profit hospitals like Northwestern and Rush and all the other big for-profit hospitals that don't necessarily are looking to take care of Medicaid patients. And St. Anthony's Hospital is one of the hospitals that belongs to the FHN network. I'm here to bring the attention to the people in Illinois that there will be a disastrous effect on the impact of Latino and African Americans in our community, and even poor white folks in Illinois. The administration has, through the Department of HFS, has issued a Medicaid managed care RFP of purchase of care to change the way we take care of health care for poor people. They've even decided to go outside of the boundary of the procurement code and go through this purchase of care, which is in essence a loophole in the procurement code, to accomplish this disastrous deed that's about to happen. It is one of the largest purchase of care projects ever undertaken by the state of Illinois, a $9 billion project. It's going to put at risk 250,000 Latinos and African Americans. If they succeed going down this path by, in essence, privatizing managed care for the poor people, they're going to put it in the hands of 4 or 5 for-profit CEOs and the governor, and they will decide how poor people's health care will be taken care of in the future. As a result, it will put a stake in these safety net hospitals that we know in our communities. These are economic engines in our poor, struggling communities. It'll put an end to, it'll put us 30% of the revenue for many of our hospitals will no longer be taken in by these hospitals. In essence, shut them down. 4,000 healthcare workers and 5 safety net hospitals. It is a crisis awaiting to happen. When this administration talks about investment in job growth in Illinois and keeping firms in Illinois, well, this action just does the opposite. It kills jobs, it unemploys working class folks, it unemploys Black and Latino health professionals in Illinois, and we are all calling on the administration to suspend this action and come up with an alternative method with consultation with the legislature on how to best take care of the poor Black and brown folks who are covered by Medicaid. With that, I'll turn it over to Senator Omar Aquino.
Thank you, Senator. Good afternoon, everyone. I'm State Senator Omar Aquino from the 2nd District. I stand here with my colleagues in support of the Senate Resolution 480. Specifically, my concern with this RFP is its impact on Family Health Network, and 2 of the hospitals that have ownership within Family Health Network are hospitals in the 2nd District. As Senator Sandoval noted, these are not only places where Medicaid recipients, many of which are Medicaid recipients that receive quality care, health care at these locations, but they're also economic hubs and engines in our communities. Norwegian American and President's Health, St. Elizabeth and St. Mary's specifically, are in the Ukrainian Village and Humboldt Park communities. They both, and including the other 3 Family Health Network hospitals, safety net hospitals, employ about 4,000 to 5,000 quality healthcare workers, but Family Health Network itself also employs separately another 500 employees as well. So there's certain concern when Family Health Network, unfortunately, it's been an MCO for about 21 years. It doesn't have the capacity to sign up for this RFP to go statewide. They do their work primarily in Cook County. That is the bulk of their work, and we want to make sure that they're able to continue that work, just like County Care and others, to maintain this MCO that its worth at a time was about over $600 million. $120 million each would go to each of these to these hospitals that would benefit them in terms of getting loans, especially in a difficult time with Medicaid dollars and MCOs and the state of Illinois with all the fiscal issues and getting dollars to these safety net hospitals. We certainly want to make sure that this specific safety net hospital that employs many Black and brown professionals and serve our Black and brown communities are taken care of. So I stand here with my colleagues in the support of this resolution and to ask the administration and demand that the administration take a pause to this RFP and really take a good look on how we can make sure that we're providing great quality care to people of color throughout the state of Illinois. Thank you so much.
Senator Martinez.
Thank you. Hi, my name is State Senator Iris Martinez. I represent the 20th District, and that's part of the Logan Square, Avondale community. And I stand here, in support of this resolution. I think we have to take a step back. I think the administration needs to step back, and we need to know exactly how this came about. I mean, when we have a resolution calling for, for some clarity, because we want to be clear. We want to have a hearing on what happened, how this RFP was put out there. And more important is, what about our safety net hospitals? We have 5 hospitals that are part of the safety nets. And those hospitals do a great job in the community and making sure they're taking care of the poor. And the fact that it also houses many of the residents of the communities because they work there. So when minus that, and you take away the ability to be able to compete, and doing a job they've been doing for the past 20 years, I think it just really has to call us to find out why this was done, where did this idea come from, and if the RFP was put out there, they knew that our safety net hospitals were not going to be able to compete in this. So, we want to just open up this process and find out. And more of anything, we want transparency. And if we talked about compassion and competitiveness that governor always talks about, this definitely is not doing that. This is doing something that many of us have to call, out and say, talk to us about how this was done, why the RFP, what's going to happen, what is going to happen to our safety net hospitals? How do we answer the questions that many will ask of us? How did we let this happen? And now our hospitals will no longer be serving the brown and Black community. So I really believe that I don't want to be repeating what they said, but I think it's very important that we really bring light to how this process took place, why it took place, and what is your answer to us on the 5 hospitals, the 5 safety net hospitals, and their future. There has to be an answer for us on that, because that is our community. We represent that. And while I'm on the outskirts of these, of at least 2 of the safety net hospitals, I have Community First in my district, right in the corner, who's also struggling. There should be a safety net, but at the same time, we have to just make sure that these hospitals that are providing that care to our communities have to remain in the forefront of anything or any decisions that are put out there by the governor or any administration out there when it comes to the well-being of our communities, stability of our communities, when it comes to the jobs and the care, the quality care that they've been providing for us for all this time. So I just ask that there is transparency behind this process, bring it out into the light, and let us have the moment that we need to ask the questions, and more important is to get the answers from the governor and everyone else as what is going to be the fate of our safety net hospitals. Thank you.
Senator Kaler.
I'm Dave Kaler from Peoria. This affects really all parts of the state, and thank you, Senator Sandoval, for bringing this resolution forward. It, in spirit, tries to do the same thing that I'm trying to do with Senate Bill 350, and that is to slow this process down. Let me give you just a little bit of history. When we passed the SMART Act, what we set in that bill was that we wanted to try to achieve 50% MCOs, and we were told that this would be a savings of somewhere around the neighborhood of $800 million. I voted for the SMART Act. I had some concerns about moving that quickly, but part of that bill and part of the understanding that we got from Director Hamlis at that point was that ACEs, which are accountable care entities, which FHN is part of that. It's a hospital-based managed care system, if you will, that they would be a part of this. As soon as the Rauner administration took over, they were eliminated. And so all of a sudden we saw, instead of that 50%, we saw us moving to 65%, which is where we're kind of at now. And with this new RFP, we'll be going to probably 100% privatization in terms of Medicaid. What that does is it takes the legislature out of really having any oversight. I'm not convinced that that the MCO strategy has saved us any money. If numbers I have seen, and I've asked for a report on this, and I did not get a complete. We did that last year in a resolution, and we did not get complete numbers or an explanation of where they came from. But if you look at the spending on a per capita basis, our spending actually seems to be up. And you say, well, why? How can that be? Well, let's think about what this strategy is. We're taking money from the state that is, provides for Medicaid patients. We give it to a third-party entity. We pay almost a 15% administrative fee. Then we pay the ACA tax. There is a tax with the Affordable Care Act. We pay that for them, and then they have a return on investment for their stockholders, which is a profit. And so we take all that money out of that system, and then we wonder why, when we have a hearing last year and we asked providers to come forward, that there was such frustration and confusion about this whole process. People, hospitals, doctors, ambulance companies, nursing homes, they're all saying we can't get paid. And part of that is, we're told we don't have a clean claim. And then we call and no one will tell us how to get a clean claim. The system is not right at this point. And for us to move forward without taking care of some of just the basics of how these MCOs are supposed to work doesn't make any sense to me. So I applaud your efforts, Senator Sandoval. I think we need to really understand what this is going to, how this is going to impact our communities. Huh? Well, a part of this is that it's going to put some of our hospitals in not just in urban areas, but in rural areas as well, out of business, because they won't be able to, if they're Medicaid dependent, they won't be able to survive economically. What we don't want is this issue of President Trump has talked about just block granting states, because we know what that means. It means less money. Mm-hmm. And so if we have less money in a system that already doesn't have enough money to take care of the poor, then we're just compounding the problems. So, we shouldn't use, the budget crisis or whatever to try to privatize this. The state, public entities have responsibilities, and this is one of them, taking care of the poor, taking care of the health care needs of the poor. If we privatize that completely, then basically we've said that the legislature has no involvement in this, and it's just a business transaction, and that concerns me. It ought to concern everybody in this state, because what'll happen then is that we saw before Obamacare, and that is that when hospitals and providers can't make it, what they do is they charge everybody else to try to make up for that. Now, the safety net hospitals don't have the ability to do that because they have such a high percentage of Medicaid. But it's going to raise healthcare costs across the board for everybody else. So I think we need to slow this down. It was not what we were promised when we voted on the SMART Act, and we need to make sure that decision-making oversight is not wrestled away from the legislature.
Senator Castro.
Thank you, Senator Sandoval. Although I don't have a safety net hospital in my district, I stand here in support of my colleagues behind me. One thing that Senator Kaler was talking about, the MCO, I have a physician who works closely with Medicare patients who is owed $80,000 by an MCO, and the MCO's excuse is, well, I'm not getting paid, so nor are you. So when you're dealing with types of things, it makes it very hard for a provider to provide care to the neediest folks in our community. The other aspect of this that's important that everyone has lamented is the fact that you're talking $9 billion contract. That is huge. That is not being looked at and has no, there's no transparency to it. We need to be involved to get some transparency to see how this is coming about, and also to address some of the needs that Senator Aquino and Senator Martinez have brought up about the safety net hospitals. When the bill was passed Before, they were included, now all of a sudden they're not. Let's open the discussion, let's stop the process, open the discussion, and let us be involved in this conversation as well. It just should not just be a select few making a decision for an entire state. So I stand in support of this resolution, and I stand in support of my colleagues. Thank you.
Thank you. Any questions?
Well, about those hospitals in your area, if there's some giant managed care program, wouldn't it be necessary for those companies to use those hospitals, therefore those people would still be working and people in the neighborhood would still get care?
Well, one of this purchase for care instrument they used, in essence, has excluded our hospitals from participating because the way it was constructed, they specified that the MCO would have to be able to take care of patients statewide. And FHN, who has been, in essence, the MCO, the healthcare network that's been taking care of the poor people in our communities for the last 20 years, well, they can't provide for people throughout the state. So it's like telling you, Bernie, you can purchase $1 million car tomorrow. You have the ability to own a Bentley, Well, but you're a state employee. You're making $40,000 a year. So it's like you'll never be able to own one of those things. That's what the message is being said to Family Health Network today.
Well, I'm just wondering if there is a statewide program, what happens to people in your neighborhoods? They're not gonna be traveling
So-
100 miles to get care. They're gonna be going, aren't they going to those hospitals? Won't those hospitals make a deal with whoever this group is?
So it's forcing FHN to essentially have to sell their lives at some point. And the problem is that FHN, before this RFP, had an evaluation about $600 million. If they were to sell now, and if they're not going to be if they're not going to get this RFP, and they don't have the ability, they don't have the capacity to apply for a statewide grant because they really focus on the county, then their valuation goes down. If they were trying to sell today, they probably would get 10 cents on a dollar of what they would have got prior to this RFP going out. So just with that, it's the impact that would have separately to just FHN as a business and as an MCO, but specifically to those safety net hospitals, that is of concern. Sure, those lives would, those Medicaid patients would at some point go to be covered by another MCO. In the process, even separately to this and separately to FHN, that's another issue. It's how are those people, those Medicaid patients, are they going to be part of of being able to decide which MCO they're able to go to? Is the state going to be deciding that? Are the MCOs? So there's a lot of questions there, but specifically on these safety net hospitals, you're essentially taking $120 million of that they had as an asset and essentially bringing that down to, who knows? It could be zero. We don't know. So the impact overall on those specific hospitals could be great. And so that's what we're trying to say is that, look, let's take some time, take a step back and see what are these consequences that occur specifically to our safety net hospitals, especially that are part of FHN.
I think that what we're really looking for is clarity. We want to open up this process and find out how it was done, why, and how can we now work towards making sure that our safety net hospitals are included in part of this whole, RFP. I mean, they know they can't compete, but at the same time is what do we tell our folks, in these hospitals, in the community, that this service is not going to be there anymore, that the employees are not going to have their job anymore. There is no clarity of what's going to happen one time this RFP has been approved and they move forward. We want to just slow this down. We want to say, let's sit down, let's have some conversations. What happens now and what is the future of these hospitals moving forward?
I guess a question, how did this sneak up on all of you as legislators? Have you talked to the governor's office and like the comptroller put out something on this yesterday? Is this coordinated with her at all?
Well, this didn't sneak up on us. We've been talking about this for some months now. Just nobody paid attention, quite frankly. But here's, and I have a little different perspective because I don't represent FHN hospitals. But if the system right now were working well with the MCO contracts that are in place, there might be a good argument for going forward. But I don't hear that from my providers. All I hear is frustration. One of the, we've taken the relationship between the state and the providers, and we've now farmed that out to a third party over here. And we've given them all the money, and we say, okay, you take care of it. And so when problems arise, the issue is, well, who addresses those issues? And the truth is, nobody. Part of what an MCO is supposed to do is provide case management. One thing that I ask all the providers that I meet with is that what evidence do you see of case management being done with your patients? And I've yet to hear an answer where they said, oh yeah, we recognize that it's good. It's non-existent. Wouldn't you think that there would be a relationship between the person managing the case of that individual and the primary care physician? Here's what happened when the whole, when the ACA was created, the Accountable Care Act. They talked about ACOs, that hospitals were going to become accountable care organizations. And that's where ACEs came out of this, the accountable care entities. And so the philosophy of how you cared for a patient really began to change. And it began to be more quality oriented. And I'll give you an example of this. At OSF in Peoria, there was a situation where a woman kept coming in for terrible asthma attacks. And so they kept treating her and sending her back. Well, finally somebody got smart enough to recognize that, well, let's send an inspector to her house. And they found out that her basement was flooded and there was mold in there. So the hospital paid to have that mold remediated. And it solved the issue. So that's the difference between just treating somebody and saying you're out the door and you're out of sight, out of mind. They now follow the patient into their environment, and the quality of care doesn't stop at the hospital door. It now goes into the community, into where they live. That's the difference. That's what accountable care organizations do. And that's where I was very hopeful as we passed the SMART Act that we were going to be able to see hospitals. We had hospitals and hospital systems working with others. Sometimes there were combinations of hospitals that were creating these ACEs. They were spending millions of dollars in producing that product, and they were then just eliminated from consideration. And that's a real loss to us because that's where the quality was. Hospitals don't have problems with adequacy of network because they have the physicians that they need in their network automatically. Okay, so what we're doing is we're stepping back on quality. We're going to a strategy where it's kind of like it's not our problem anymore. We're just going to give this money out here, and then they have to take care of it. And I think it's a bad move. We need to make sure that we have really put quality into the formula. That's the only way you reduce healthcare costs is you increase quality.
I'll summarize my thoughts by saying this purchase of care exercise was like a bomb that was dropped on our communities overnight, okay? This is a hostile takeover of the Medicaid program in the state of Illinois without any consultation with the legislature. We have an obligation by statute, right, to have a say in how to manage healthcare for people in Illinois and particularly the poor communities that we serve. We have not been part of that conversation. Felicia Norwood has never had a conversation, to my knowledge, with any of us before her department issued this purchase of care. Not one conversation. Not one conversation. The means does not justify the end here, right? We need to talk about passing a budget, a full budget for the state, and move on. Part of that process is the healthcare budget, right? Felicia Norwood should not has managed this kind of as a merger and acquisition exercise, right? This privatization of a major responsibility of hers to take care of the poor, the Medicaid program. She is, in essence, saying, I'm going to get out of that business. And if she wants to get out of that business by putting it in the hands of a handful of for-profit CEOs, like the company she worked for at Aetna, well, then we're not going to allow her to do that. But if she wants to do that, maybe she just get out of the business of being the director. Because if she doesn't not want to manage healthcare for people in Illinois, then maybe we just need another director.
We're talking about a resolution, right? Other than raising attention to this, what can the legislature do?
Well, I filed Senate Bill 350, which talks about allowing ACEs and hospital-based solutions to come back into this process, and it sets aside a percentage that we would achieve. We would not expand any more Medicaid mandatory enrollment until we've achieved this. So my bill and this resolution really hit at the same thing.
So this afternoon's committee subject matter open?
For the resolution?
Yeah. Oh, no, okay, never mind. Are you gonna have?
No, yeah, I was like, we're-
That was pretty quick.
You're gonna have FHN representatives there this afternoon?
we don't know. I mean, again, if they've been so silent and they've avoided even talking to us about it, I don't know. We're gonna work on these two. This is our priority, making sure that this resolution, is brought forward, and that the bill that Senator Kaler also has. I think it'll address the issue. They're gonna have to come and talk to us and find and explain to us what is going on and what are we gonna do moving forward. That's
Only
our
to the
goal.
extent that, again, in this purchase of care design, in the purchase of care design that was created by Felicia Norwood and the administration, it puts a gag order on anyone who wants to participate. They cannot speak. FHN have been told. It's in the purchase of care specification. No one can speak to anyone about it. They even have a problem and concern by talking to their legislators who represent them of being in violation of the RFP and then being not allowed to compete. That's how contrived this Purchase of Care Act has been designed. Not even the networks can speak to us.
I will anticipate that the Rauner administration is going to say, while you're worried about the business model of the hospitals in a certain area, it's really the taxpayers and overall savings that are the issue, and that people have been talking about more managed care for years to try to save money.
If there was proof that money was being saved, I would be very receptive to that. But I don't see that evidence. I see evidence that is to the contrary, where it says that we're actually, spending more money per capita than we were in fee-for-service. Now, I don't think anybody, wants to say we go back to fee-for-service, just straight fee-for-service. No, we need to organize this and again, put the quality component into it. But there's been no proof that this has saved any money.
We have Heather Staines, Senator Heather Staines would like to say a few words in comment. She is actually the resident expert, one of the resident experts on this topic, who we also lean on as a colleague to help us through this process of trying to bring justice to this process. Senator Heather Staines.
So we've had a couple hearings in the Medicaid Managed Care Oversight Committee, and lots of issues we've heard about in terms of how the Medicaid Managed Care system is working. I think trying to go to care coordination really has been the right direction. But then there's been lots of challenges with how it's operating. Certainly concerned that and understand trying to address those, concerned about timing when we're trying to do this in the midst of having no budget, trying to do this before we've solved a lot of the implementation problems, and going statewide, I think, provides some concerns. And then doing such a large purchase through a purchase of care and not going through the regular RFP or traditional procurement process also gives some concerns. It's the most significant, largest spend that the state does in GRF. Aside, we sort of have pensions on our pension and our bond payments, but aside from that, Medicaid is the largest portion of how we spend our dollars. It's an enormous source of concern, and just trying to make sure we have a very transparent process in which everybody is playing on a level playing field is of concern when there's not been a much input provided or opportunity for input to the policymakers.
And is it stoppable at all, or can the administration just do this, or I guess?
My understanding is the administration can do this.
I'm trying to connect the dots. This is sort of new to me. Is this just a sort of parallel effort from the governor's office, not necessarily related to CCP and the community reinvestment, sort of the long-term managed care stuff?
Not that I know of.
Yeah, the purchase of care for the Medicaid managed care is totally separate and apart from the CCP process. That's a different program run by a different agency. That's run by the Department of Aging. This is all run by Healthcare and Family Services. There are some overlaps in terms of Medicaid patients may end up, being served in nursing homes and through other programs. And a lot of the people in the CCP program are Medicaid eligible, but they're run very distinctly.
You know, I think that this is, the administration has not had a victory over the last couple of years in passing a budget. And that responsibility is shared both by the legislature and the administration. I'll fess up to that. But because there's been no victories in passing a budget, this, for them, may be one huge victory for them, right? So that they can say that they're saving, billions of dollars of taxpayers' money by continue cutting Medicaid, right? By reforming Medicaid, when in essence, what they're doing is just privatizing Medicaid, right? Unemploying over 5,000 people in the Black and Latino communities, shutting down hospitals, which in essence, shutting businesses down that employ people so that they can get back on the campaign trail.
Your sign over here links Trump and Rauner, but I don't think the Rauner administration, they don't even say his name, and I don't think they're necessarily for those things that are on that chart. Isn't that a little over the top?
Well, no, it is not, because,
They don't want
because
the block
you,
grant, I don't think. They've said, let's go slow on any changes and.
well, they may not be working in conjunction with each other, but let's face it, the Trump administration wants to do a block grant on Medicaid, and with the changes now that we see by this RFP process, what it does is it takes the legislature out of the game. And that's the problem, is that we have a responsibility to our constituents.
Are there any other states that, or a governor has made a move like this, where we've seen this actually implemented?
We don't know. We don't know.
No.
Trying to figure out Illinois.
Thank you.
Yeah.
Thank you very much.
Exactly, thank you.
Yep.
It should be over in the press room.